Let's see an NCLEX RN video based on care for the adult patients with obesity. A patient with a BMI of 37 kg per meter square asked a nurse about whether or not to have bariatric surgery. Which statement by the nurse is best? Bariatric surgery is an option for patients with a BMI of 25 kg per meter square. Many patients have terrible complications from bariatric surgery. Bariatric surgery in obese patients has been shown to increase life expectancy. If you are unable to lose weight by dieting, bariatric surgery is the easy way out. Bariatric surgery has been shown to increase life expectancy in patients with obesity. The nurse should avoid offering their opinions that is not based in facts or reflect value-based statements. The nurse monitors for which preventable complication in a patient hospitalized for treatment of obesity. Hyperventilation, tachycardia, skin breakdown, hypertension. Skin breakdown is a preventable complication. Hypoventilation is more common in obese patients, not hyperventilation. Hypertension is a long-term condition that does not commonly worsen due to hospitalization. Tachycardia can be a sign of complication and should be investigated. The nurse is developing the care plan for a patient after bariatric surgery for morbid obesity. The nurse includes which of the following on the care plan as the priority complication to prevent. Fluid overload, wound infection, depression, anastomosis leak. Wound care is always a priority in morbidly obese patients due to skin folds. Wound infection can be a complication after all surgical procedures, and good skin care will help prevent this from occurring. Fluid deficit is more common than fluid overload in patients after bariatric surgery. Depression, while possible, is not a condition that the nurse can likely prevent. A leak at the anastomosis site is not a condition that the nurse can prevent. A patient undergoes bariatric surgery. Immediately following surgery in the post-anesthesia care unit, which intervention has the highest priority? Assessing the surgical site for signs of infection, educating the patient on post-operative dietary restrictions, monitoring respiratory status for signs of hypoventilation, repositioning the nasogastric tube for optimal drainage. Hypoventilation is a concern after all surgeries but is particularly concerning in patients with obesity. Signs of surgical site infection will not show up immediately following surgery, and postoperative education would be better received when the patient has had time to recover from anesthesia. Repositioning the NG tube in the bariatric surgery patient is never safe. So here the highest priority is monitoring the respiratory status for signs of hypoventilation. Nurse is providing patient with postoperative instructions following an adjustable gastric banding. Which information should be included in the education? Importance of vitamins due to malabsorption, small meals to prevent anastomosis leak, date and location of support group, instructions for injecting saline into the port. Support groups have been shown to help patients after weight loss surgery. This adjustable gastric banding does not cause malabsorption. The intestinal lumen is not cut, so there is no anastomosis. The patient will not be injecting into their own port. So here data and location of the support group needs to be given. Using the NIH classification for BMI, the nurse identifies the patient with a BMI of 32 kg per meter square as which category? Overweight, Class 1 obesity, Class 2 obesity, extreme obesity. According to the NIH classification system, patients with BMI of 18.5 to 24.9 are normal weight, BMI of 25 to 29.9 are overweight, BMI of 30 to 34.9 have class 1 obesity, BMI of 35 to 39.9 have class 2 obesity, and BMI greater than 40 are categorized with extreme obesity. So here with a BMI of 32 kg per meter square is classified under class 1 obesity. The nurse correlates which clinical manifestation to the pathophysiology of obesity. Increased waist circumference, increased basal metabolic rate, binge eating, joint pain, yellowish skin. Increased waist circumference is associated with increased abdominal fat. Binge and compulsive eating are manifestations of behavioral changes associated with obesity. Joint pain increases as the BMI and weight increases. The basal metabolic rate is typically decreased in obese patients. Yellowish color changes are associated with hepatic disorders and not directly with obesity. Thus, increased waist circumference, binge eating, and joint pain. Which diagnostic result does the nurse assess in patient with obesity to evaluate for concomitant Cushing's disease? Growth hormone, thyroid stimulating hormone, urine cortisol excretion, hemoglobin A1C or HbA1c. In patients with physical characteristics of Cushing's disease, 24-hour urine collection for urine-free cortisol excretion should be performed. Growth hormone deficiency is a secondary disorder associated with hypothalamic dysfunction. Changes in secretion of thyroid stimulating hormone are associated with primary or secondary hypothyroidism. Hemoglobin A1c provides data on glucose regulation over a period of time. In administering Orlistat to a patient for weight loss, the nurse recognizes which is the mechanism of action of this medication: reducing fat absorption, suppressing appetite, increasing satiety, accelerating metabolic rate. Orlistat inhibit pancreatic lipase, thereby reducing the dietary fat absorption. Lorcaserin affects chemicals in the brain that helps to regulate appetite and increase the feeling of fullness after eating, so less food is eaten. Phentermine is approved by Food and Drug Administration to suppress appetite for up to 12 weeks. So here Orlistat is for reducing the fat absorption. The nurse assesses for which clinical manifestation of dumping syndrome in the patient after bariatric surgery: nausea, increased urine output, hypoglycemia, diarrhea, abdominal cramping. Rapid emptying of stomach into the intestine leads to nausea, vomiting, abdominal cramping, and pain. Diarrhea, bloating, belching, and fatigue also. With loss of fluids, the patient will demonstrate signs of fluid depletion, including decreased urine output, decreased BP, and tachycardia. So here the dumping syndrome clinical manifestations include nausea, diarrhea, abdominal cramping. Which position does the nurse place the patient in to minimize the complication in patient with OHS or obesity hypoventilation syndrome? Prone with hips elevated, head of the bed elevated 30 to 45 degrees, side lying with head flat, head of the bed elevated 90 degrees. So, obesity hypoventilation syndrome is worsened when patients are supine or prone. Elevating 30 to 45 degrees optimizes the diaphragmatic excursion and minimizes the pressure of abdominal contents on the thoracic cavity. So we need to elevate the head of the bed 30 to 45 degrees in obesity hypoventilation syndrome. Which statement by the patient being discharged after gastric bypass surgery indicates the need for further teaching? I may need to take a multivitamin every day. I may develop constipation while I am taking pain medications. I should not lift anything heavy until cleared by the surgeon. I should drink at least 1 cup of fluid with every meal. Due to decreased size of stomach, fluid should be consumed between meals. Multivitamins may be needed due to decreased absorption of fat-soluble vitamins, including A, D, E, and K. The patient is at increased risk of constipation due to possible dietary restriction and use of opioids for pain. Lifting is limited postoperatively to decrease the strain on the surgical site. So here, the patient needs further teaching if he or she says, I should drink at least 1 cup of fluid with every meal. Miss Valley, 34-year-old, was diagnosed with obesity 15 years ago. She has tried various dietary and exercise programs along with pharmaceutical options. Her weight is interfering with her ability to walk and participate in social activities with her family. She is currently 5 feet 6 inches tall and weighs 256 pounds. She presents to her primary care provider to discuss a referral to a bariatric surgeon for weight loss. Miss Bailey is referred to a bariatric surgeon by her primary care provider. Other than her obesity, Miss Bailey also has mild hypertension and chronic joint pain. She is referred to an information session on bariatric surgery, and after this session she desired to have laparoscopic RYGB surgery, that is Roxanne gastric bypass surgery. Miss Valley undergoes gastric bypass surgery and has an uneventful post-operative course. On post-operative day 2, her bowel sounds return, the NG tube is removed and she is allowed sips of clear fluids. She is discharged to home the following day with instructions to monitor her temperature every 4 hours and to contact the surgeon if she has an elevated temperature, nausea, vomiting or increased pain. She is to return to the bariatric surgeon for post-operative follow-up in 7 to 10 days. Miss Bailey is 5 feet 6 inches tall and weighs 256 pounds. The nurse calculates her BMI to be which value? 19 kg per meter square, 34 kg per meter square, 41 kg per meter square, 49 kg per meter square. BMI is calculated by dividing weight in kg by height in meter square. So you need to convert these values into kg and meter. Then you will be getting a value of 41 kg per meter square. Miss Bailey, if she qualifies for bariatric surgery, what is the best response by the nurse? No, you are healthy and therefore do not qualify for bariatric surgery. Yes, you meet the BMI criteria, but I would not recommend bariatric surgery for someone so young. I know someone who died from it. No, you do not meet the BMI criteria for bariatric surgery. Yes, you meet the BMI, but there are several other factors that determine whether someone should have bariatric surgery. Miss Bailey does qualify for surgery based on BMI alone, but BMI is only a consideration for surgery. Here option A and C provide inaccurate information. B is incorrect because the nurse should not impose personal beliefs on the patient. So the correct statement the nurse should tell us, yes, you meet the BMI, but there are several other factors that determine whether someone should have bariatric surgery. Miss Bailey wants to know the key difference between Roxanne and adjustable gastric banding. Which explanation by the nurse is most accurate? Some surgeons just prefer one over the other. Roxanne is a combination of a restrictive surgery and a malabsorptive surgery. Adjustable gastric banding is designed to be temporary. Roxanne is a type of adjustable gastric banding. Roxanne is a combination of restrictive surgery and a malabsorptive surgery. While the option A is true, it does not factually answer the patient's question. Option B is the correct one. The nurse is caring for Miss Bailey in the pre-surgical suite. The patient asks, "Will you hold my hand? I'm getting nervous. My mom told me this morning that I would die from this surgery. Which action by the nurse is best?" Patting the patient on the shoulder and covering her up, asking her if she would like some alprazolam to calm her down, holding her hand and listening to her concerns, explaining that the percentage of people who die from bariatric surgery is small. The nurse should respond to the patient request by holding her hand and then employing active listening skills when the patient expresses a concern. Patting a patient on the shoulder rather than holding her hand as she requested would seem to diminish the patient's concern and seem patronizing. The nurse should not diminish the patient's concern by stating facts. Oral anxiety medications would be inappropriate in a patient preparing for gastric surgery. So here the nurse needs to hold her hand and listen to her concerns. The nurse is caring for Miss Valley in the post-anesthesia recovery unit. The patient is 2 hours post-gastric bypass surgery and has an NG tube. The orders state the NG tube should be hooked up to low continuous suction. There is scant blood-tinged drainage coming from the tube. Which action should the nurse take? Call the surgeon right away, reposition the NG tube, discontinue the NG tube, document the findings. Patients are on nil per oral status and have a bowel preparation before bariatric surgery. There should be no food in the stomach. A small amount of gastric acid tinged with blood is normal since the stomach and intestinal lumen has been cut. The nurse should never remove or reposition an NG tube in a bariatric surgery patient. So here the action the nurse should do is document the findings. Hope you understood this video. Thank you so much. Please do keep watching.